Let there be carnage. I have broken my fast, my thirst has been quenched, my energy is restored, and I am ready to choose violence. Iftar Mubarak, guys. Do not ask me what is inside this bottle. I do not know myself. All I know is that it has turmeric inside and it is delicious. When you're hungry and somebody gives you food, you take it and say thank you. You do not ask questions, especially when you did not help in the kitchen. Hey guys, welcome back to my channel. If you're new here, subscribe of course. My name is Dr. Mariam and I make medical videos. Today we're going to talk about a topic that needs to be addressed because it is tired, everyone's tired, and it needs to be addressed. And that's the toxicity of medical doctors in Nigeria. This video was inspired by a cover I did at a private hospital not too long ago. So as a medical officer or a junior doctor in Nigeria, sometimes because residency sports are hard to get, before you get residency, sometimes if you don't have a permanent job, you might need to take covers at hospitals. So that means you're not really employed there. You just go there certain times when there's an opening to cover for a specific doctor, and then you get paid per hour. Anyway, so my sister was out of town and needed me to cover her shift in the hospital she works at. And I did that. I went and I covered her shift. And when I went there, like what I experienced honestly just made me think about how medicine is practiced in Nigeria and what the problem actually is. So I walked into the clinic, introduced myself to the staff, and then walked straight into the office of the consultant to introduce myself as the doctor covering for my sister. Very nice guy. We had a little chat and then he told me that if there's a patient, I can come in and we will see the patient together, right? So after a while, we got a patient and I took a chair, went to his office, and then just witnessed everything. So this man, like from his manners to just everything, like literally just the ideal doctor. Yeah, right now I'm just going to put it out there. He's not Nigerian. Even if he's Nigerian, he was not raised here. So first patient came, I took my chair, carried it to his office and sat down next to him to see the patient together. He told me briefly about the patient before the patient came in, and then he stood up. I even thought he was going to get something, but then he walked out and he called the patient into the clinic. I could hear them conversing in the hallway before they came into the office. She was an elderly woman with a background of hypertension, diabetes, chronic subdural hematoma, which is bleeding inside the brain, and then glaucoma. She had a significant medical history. And from the way he was talking to her, I knew he was familiar with her because I could feel it in the tone of his voice. He was very familiar with her. They were very friendly and they were chatting. He was asking her about how she was, her family, and everything. When they were coming in, this man opened the door for her and she came in, and as she was about to sit, he pulled the chair out for her and she sat down and he pushed it back. And I was really surprised because to me, I've never seen a doctor do that, at least in this part of the world. So anyway, he went back to his seat and he started taking her history, right? During the history, I still continued to be surprised by this man because he was so friendly towards her. He was laughing, he was making jokes, he was listening. He was actively listening, and you could tell by the tone of his voice, his facial expressions, his body language that he genuinely cared for this woman. So the history continued and came to an end. All the while, this man never losing empathy for this woman. After he finished taking the history, he just left an open discussion with the patient. He calmed her down, like asked her if she had any questions, and carefully and very, very gently addressed all her concerns. Like honestly, during the entire consultation, the room felt warm. Like I was comfortable, he was comfortable, the patient was comfortable. All of us were just comfortable, and the consultation was going really, really well. He explained her diagnosis and everything, walked her through her treatment plan and the steps forward, and then sent this woman packing, right? After she left, he turned to me and he asked me if I had any questions, which I did. I always have questions. The point is, during the consultation, this man did not feel like the consultant to me. During the entire consultation, he felt like a friend to her and he felt like a friend to me. There was no imposing authority that he had on me, so I was comfortable and the patient was comfortable. Contrast that to how things are done here normally. Honestly, it got me thinking and comparing my experiences, like the consultations I had been a part of and what I witnessed with him. And then a story immediately came to mind. So once upon a time, I was sick in Kano during my house job and had to get some investigations done. I'll never forget, I was admitted and I had to get an ultrasound done. So the hospital assistant wheeled me to the radiology department and I waited in the area and then was called in later to see the radiologist. Okay, so when I went in, the radiologist performing the ultrasound was a consultant, and he had with him either a senior registrar or junior registrar. Either way, he was a resident with him. And as they were doing the ultrasound on my abdomen, he was walking the resident through, like explaining the anatomy to him and then certain features. And then he mentioned a cyst. So my immediate response was just to turn to them and innocently ask, politely, I have a cyst? And then you cannot imagine the reply that this guy gave. The consultant, that is. He just turned to me and he was like, I was not talking to you.
Emotional damage!
Excuse me? You're doing ultrasound on my abdomen. I'm asking a question. You're saying you're not talking to me. Yet it is my body that you are using to describe to somebody else. So can you see the problem here? I was utterly flabbergasted by his response, and I was just shocked and lost for words for a few seconds. The first words that just came out of my mouth unconsciously were, I'm a doctor. And he was like, oh, sorry, I didn't know you were a doctor. And then that was when he was like, oh no. And then he explained whatever it is that he was explaining to the other person to me. So my point is, do I have to be a doctor for you to be polite to me and then talk to me like a human being? Which is a problem that a lot of Nigerian doctors have. I don't know why we feel the need to be very, very disrespectful and rude to patients for no reason, especially when it comes to patients wanting to know information about themselves. Like it's the patient's body that you're using to explain to somebody else. Even if you're not explaining to anybody else, it's their body. They have the right to know what's going on. But I don't know why some Nigerian doctors have an issue with you asking them questions about your own health. Like honestly, I just had to like stop and think, like, is this what patients go through? Because in that moment, I was a patient. Like I wasn't thinking of myself as a doctor, and I was like, wow, so a lot of patients actually have to put up with this BS. And the most annoying part is that the toxicity does not even stop at patients. Like Nigerian doctors are toxic to themselves. Another scenario, right? When I first graduated medical school and was about to write my MDCN exam, I was doing a hospital rotation in Wuse District Hospital. So I was there in the EPU, which is the emergency pediatric unit, and I was observing the practice there. So during my rotation there, one time a patient was brought in, a little boy. The boy was brought in really, really sick, and I think he was diagnosed with sepsis, focused chest. I think he had pneumonia that spread to the blood or something. Anyway, so during the management of this patient, I saw that he was administered hydrocortisone, which is a steroid. And in my head, from the little knowledge that I had, I knew that like steroids could be used for like cases of meningitis, but I didn't know it had a role in pneumonia, right? So as a student, I did what a student was supposed to do. Ask why. Ask a question, right? Because I did not know the answer. So I asked, was there a reason why we gave this patient hydrocortisone? Because this was what I knew from my knowledge back in med school. This man just gave me one icy look. Honestly, like I got goosebumps when he gave me that look. He was just, he turned around and he looked at me like I was the stupidest person in this world. And then the words that came out of his mouth was just, go and read. Like, so rude. Can you imagine? Like, I am a student, right? I am attached to you for a reason. If there's anything I do not understand, I'm supposed to ask you as my senior colleague so that you can answer my question and guide me. Okay, so let's say he doesn't even answer my question, right? Because there's this thing that Nigerian doctors do. I don't know why they think that way. Apparently, if you ask them a question and they answer you directly, it's like they're spoon feeding you. You have to go and do the research yourself and find the answer yourself. Please make that make sense. Anyway, right? Let's say he didn't want to spoon feed me. He could have just told me politely, like, okay, let me give you this as an assignment. Go research it and then tell me tomorrow. Like, he didn't need to be unnecessarily rude. Like, it's honestly tiring how rude doctors can be in this country. Like, I am a doctor and I'm calling you out. I'm calling all doctors out who are guilty of this behavior, and many doctors are guilty. I would go as far as to say most doctors in Nigeria are guilty of that. Like, being a doctor doesn't give you an automatic pass to be rude to somebody, okay? You have to treat people as human beings. And I get that sometimes it's the frustration, like doctors and other medics can be frustrated with the system, you know, system failure and a lot of other things that can be frustrating. And then then there are some patients that are actually really annoying. Like when I say annoying, I mean really annoying. Like they'll just come to frustrate your life, and some of them can be so rude as well. Like for example, you have instances where you have really good doctors doing their best for a patient, and then you have the patient relatives insulting the doctors, genuinely trying their best to save the patient, and even undermining their efforts despite the doctor trying their best, and sometimes even depriving themselves of sleep because of your patient, yet you're undermining and insulting the efforts of these doctors. But still, that does not give you an excuse to not be kind. As healthcare workers, and I'm not just talking about doctors here, I'm talking about doctors, nurses, pharmacists, lab scientists, cleaners, hospital attendants, everybody that works in the hospital, right? We're constantly around sick people, and we're supposed to be the most empathetic people out of every profession out there, because we're constantly around people that need the empathy, yet we're the rudest, and I don't understand why. Okay, and I don't know why the problem is localized here, because where I trained wasn't like that, and the consultant I did the cover for at the private hospital was not like that as well. Surprise, surprise, he's not fully Nigerian, and he did not train here. I'm not here to say that all Nigerian doctors are bad. There are genuinely good doctors out there. Like I've personally met and worked with a lot of good and nice doctors out there, but then that doesn't take away from the bad eggs that are out there. And honestly, when I did the cover at the private hospital and worked with that man specifically, it reignited my passion in medicine. Like I loved medicine again. Like doctors have a love-hate relationship with medicine. We're always complaining, but the passion is there. Sometimes it dies because of the system. Like you have no idea what happens in the hospitals and everything, like the things that are supposed to happen, like expectations versus reality. Anyway, I digress. So working with this man actually brought back that passion for me. I was happy, and I just felt fulfilled as a doctor and what we were doing for these patients. Like in this country, we're still holding on to authoritarian medicine, which was the medicine practiced in the past, where the doctor takes on this intimidating, imposing fatherly figure on patients, and that's not practiced anymore. Modern medicine right now is gearing towards patient autonomy, like serving patients and being friendly towards patients. Like it doesn't kill you to be kind, to be nice to somebody, and to treat them like a human being, which is something we have a problem with as doctors in this country. I have worked with really toxic consultants in the past, like because they feel they're consultants, they can do or say whatever, sometimes even insult people, not just patients, even doctors. Like there is a huge problem, honestly. And the point of this video is just like an appeal to doctors to do what's right. Being a doctor does not give you an automatic pass to insult anybody, disgrace anybody, you know. It doesn't give you permission to be rude, and you as a patient need to know that you do not deserve to be treated that way by anybody, including doctors. No doctor has the right to yell on you, no doctor has the right to shout on you. You should know that, and the next time any doctor does that to you, you should call them out. I always say, like, not enough lawsuits happen in this country. If people were being put in their place, everybody would go back to acting right. It's not that we can't do it, we just choose not to do it. Like look at this man, the man I worked with. Does he have two heads? He's just like any of these consultants, but he made the conscious decision to act right by himself and by his patients. Like it really does not take away from you to treat somebody like a human being. So really the issue runs deep. It's both doctors and patients, but the point of this video is for the doctors. I will do one for the patients. You are not escaping. I'll do a video for the patients as well. So let's just try to do better, honestly. Like I just wanted this to be a short video where I tell you that it is not impossible. It can happen. We just need to make the conscious decision to treat people with kindness. Anyway, let me know in the comment section below your story with doctors. Like, has a doctor ever been rude to you? Please let me know in the comment section below your experiences with doctors. Okay, so this brings us to the end of our video. If you liked anything I had to say, or you think this topic is important and needs to be talked about more, please leave a like. Don't forget to subscribe to my channel. Thank you for watching, and I'll see you next time.